Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
The psychiatric mental health nurse practitioner is considering a diagnosis of narcissistic personality disorder in a new patient. When reviewing the history and physical examination, which of the following findings would be most consistent with this diagnosis? A, the presence of fixed delusional thought. B, disdain for weak or sickly people. C, a history of antisocial behavior. Or D, extreme drama in most personal relationships. Which of the following or which of those is most consistent with a diagnosis of narcissistic personality disorder? So remember the personality disorders. There are 10 of them. They occur in what's classically described as 3 clusters, cluster A, B, and C. Classically described as mad, bad, and sad. A, mad, B, bad, and C, sad. So the cluster A personalities, the quote, mad personalities, these are those that may be seen as, borderline psychotic features, like the paranoid personality disorder does have a persistent preoccupation with people being out to get them, borderline on paranoia and delusional thought. The schizoid personality is the personality that really genuinely has virtually no interest in interpersonal relationships, lives very much the loner life, may be seen as the, quote, crazy person on the street who lives alone and nobody ever comes in and out of the house. And then the schizotypal personality is similar. They typically don't have normal interpersonal relationships, but more because their thinking is somewhat magical and just a little bit off, and they tend to be a little bit of loners too. Those are your cluster A's, your mad personalities. Cluster B are the bad personality disorders. These tend to be the ones that are characterized by dramatic behavior and extremes of behavior. And the cluster B personalities include the narcissistic personality disorder, the borderline personality disorder, the histrionic personality disorder, and the antisocial personality disorder. And then finally, the cluster C personality disorders are the dependent personality disorder, avoidant personality disorder, and the obsessive compulsive personality disorder. So the question here is about a narcissistic personality disorder, which is one of the cluster B, the quote, bad ones. These do tend to be more dramatic in their approach to the world and the more dramatic in the way they are regarded. So the question is specifically, what is most consistent with the narcissistic personality disorder? Remember, the narcissistic personality disorder is the person that is preoccupied with power. They believe that they are powerful. They believe that they are important. It matters to them that others perceive them as important. This is always the person that's going to want to talk to the boss, the person that they think is most worthy of them. And so as we look at the characteristics of narcissistic personality disorder, let's evaluate these answer choices A, B, C, and D. Well, B is the correct answer. Patients with narcissistic personality disorder, not only do they tend to be preoccupied with power and authority and being important, but they tend to be very disdainful of those that they perceive as weak or sickly or otherwise imperfect. The narcissist is impressed with power and strength. Those are the people that they feel are worthy of them. Fixed delusional thought, option A, isn't really characteristic of narcissistic personality disorder. That really is more consistent with delusional disorder, which is an entirely separate DSM-5-TR diagnosis. A history of antisocial behavior is not really present in the narcissistic personality. Antisocial personality disorder is yet another form of cluster B personality disorder, and the characteristics are very different. And the extreme drama in most personal relationships that we see as answer choice D is much more characteristic of the borderline personality. So when we look at these features that are most consistent with the narcissistic personality disorder, it is definitely B, disdain for weak or sickly people. These personalities respect power and strength, and they are almost repulsed by who they perceive as weak or sickly or otherwise inferior.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.